get started. Welcome and thank you all for joining us tonight for our second info session we've had so far for our new Doctor of Nursing Practice program at Benedictine University. We're so glad you could all join us. Please note that this will be recorded, so once it's done, if there's anything you feel like you missed, don't worry. We can send you the slides in the session. You can go through it. You'll notice as we go on, the PowerPoint does have links in it, hyperlinks to certain web pages and things like that. So once we get this all finalized, we'll send it to you tomorrow. As we go through, we will also have a question and answer session at the end. That way we can get your questions answered as they come up. So let's get started with some introductions. I'm Jenny Jeske. I'm the Assistant Director of Admissions for Graduate and Doctoral Programs here at Benedictine. And with us today is Dr. Deborah Jesuit. She is the Assistant Professor and BSN Director, also serves as the Department Chair of Nursing and Health. She has her PhD in Nursing Ethics from Breast University, and then received her Master of Science degree, MSN, from Purdue University, Calumet. So we're glad to have you with us, Dr. Jesuit. We also have Dr. Allison Ridge, as many of you, if you're alumni, know as well. She's the assistant professor and serves as the director of the MSN program. And she's been with the university for, I think it's over a decade now, which is great. So she received her BSN, MSN, and DNP from Rush College of Nursing. So thank you both for being here to talk a little bit more about the program, and I'll hand it over to you.
Okay, so this slide just kind of shows that the Department of Nursing and Health mission aligns with the university mission, and what we look at is learner-centered education grounded in the Benedictine values through excellence in teaching, scholarship, and service. So that's kind of what we follow in the nursing department, which fits well into the university mission, which also follows the Catholic intellectual traditions. Okay, next. This is a visual of our hallmarks. So in the program, and all of our programs right now, the RN to BSN, the MSN, and then soon to be the DNP, we follow the Benedictine hallmarks, which are hallmarks of the university, the Benedictine University. And we incorporate these into each of our courses, so that students are very aware of how we follow that Benedictine intellectual traditions. The hallmarks, they're kind of mixed up here, but they're basically love of Christ and neighbor, prayer, stability, conversatio, which is how come I can't think of the word now? Come on, Allison, I can't think of the word.
Transformation.
Transformation, that's it. Obedience, discipline, humility, stewardship, hospitality, and community. And they fit really well with pretty much everything we do in nursing. So it's really easy to integrate these through the courses and have you outline how they fit into what you do every day as a nurse. And then the next slide is our program goals. You can see that our mission themes are there, which are the inclusive community, learning and scholarship, service for the common good, and again, grounded in our Benedictine values. And each one of our program goals aligns with those. So we want to advance nursing knowledge, make sure that we cultivate innovative nurses who have cultural humility, and also look at nursing more globally. We like to make sure that our graduates have ways to improve health outcomes, that they nurture other nurses, that they use information technologies, and that they're basically forward thinkers and look at ways to do patient care and all the other roles of nurses a little bit better. We like to make sure that all of our graduates are very comfortable with interprofessional communication and interprofessional partnerships. So there are a lot of things throughout all of our courses that have you doing work or looking at interprofessional teams. And then finally, to make sure that our education that we provide for you transforms you in a way that you are different and look at things very differently and more globally than when you entered into the program.
Okay, so here, and I think we're going to see two slides on the DMP student learning outcomes. And I wanted to mention that all of this information is also on the website, the Benedictine University Department of Nursing and Health website. So in addition to having the slides, you can always refer back to the website for more information. But Benedictine University, as a university, we have 10 learning outcomes. And so there is a DMP end of program student learning outcome aligned to each of the Benedictine University learning outcomes. So for example, and I won't read through them all, but we'll look at the university, we expect to develop students in disciplinary competence and skills. And so our student learning outcome is integrate nursing knowledge and science and relevant science-based theories as the basis for the highest level of nursing practice. And you can see each one: analytical skills, critically appraise existing research to determine and implement the best evidence to advance the scholarship of nursing. So these learning outcomes, the goals are very broad goals that we expect, but these are more specific student learning outcomes that by the end of the DMP program, we expect that you will achieve these goals. So you can see systems thinking, making informed decisions using data and technology and effective communication, leading interprofessional partnerships and teams, as Dr. Jesuit mentioned, and being ethical and fiscally responsible. And if we see the next slide, leadership, of course, advocacy for person-centered care, engaging in partnerships to improve equitable population health outcomes, the systems-based DMP project that we will talk about in a little bit more detail later, and demonstrate the ability to function independently in nursing leadership roles within complex systems. So those are the 10 student learning outcomes. Okay, in this slide, we kind of provide an overview about the program as a whole. And so the curriculum of the DMP program does align with the American Association of Colleges of Nursing, AACN. They just released new essentials documents that outline what is expected of entry to practice and then advanced practice. So our curriculum aligns with the newly released essentials, core competencies, for professional nursing education. Dr. Jesuit's going to talk a little bit more about that when we talk about what competency-based education is. And then we do align with the older essentials, which are basically subsumed within the new essentials, and that relates more to our accreditation. So that's why we list them both, but really the curriculum is aligned to the most current 2021 AACN essentials. So all coursework is in an online asynchronous learning environment with due date driven timelines. So, you know, there might be an assignment due on a Friday or a Wednesday or a Sunday. It's all outlined in the course. Now for the DMP, we will be having some synchronous touch points, and we will be doing an orientation just before the start of the first course. We're going to ask students to plan on a 2-hour orientation. Not sure if it'll go that long, but we say plan for 2 hours. And then we're going to have touch points throughout the curriculum, one in preparation for getting ready for practicum and thinking about the CAPS or the DMP project. And then actually at the end of the first DMP practicum course, which is when you will develop your project proposal and present it and get approved to move forward with it. And then in the fourth practicum course, the dissemination of your project, how your final project turned out, you'll present that. And we say for those 2 synchronous touch points, plan on 2.5 to 3 hours each. Of course, the clinical component of the DMP program is on ground at a clinical site of your choosing with a preceptor, meets criteria to serve. And we're going to talk a little bit about practicum on another slide, but that's each course is 8 weeks in length. And so there's 2 every semester. We have 3 semesters in a calendar year. If you move through the program without taking any breaks, you can complete in 2 years. Of course, longer if you need to take some breaks, or we're going to talk about NRHL 7000, whether you want to do that in advance of or concurrent with DNP foundational coursework. There is an opportunity, and we're going to show you in the next slide an example, but there's, can you just go back 1 second, Jenny? Thanks. We're going to have opportunities for networking and work with the organizational development PhD students. And now we can take a peek at the next slide. And this is the lecture that is coming up this spring. It's just in a couple of weeks. We have 2 speakers coming to campus to present, and there are a variety of activities across the day-long session. And we'll be working with the faculty of the organizational development program to look at opportunities for the DNP students to network and connect with the OD students. And then because this is a brand new program for the university, once we enroll students and we get students moving through their first year, then we will actually apply for accreditation. That's the accrediting body requires it this way. And then we will write what's called a self-study and hold a site visit, and then receive our accreditation before the first cohort of students graduates. That was on that earlier slide that I just wanted to touch on. Okay, you're going to turn it back over to Dr. Jesuit.
Okay, so a couple of years ago, the AACN, the American Association of Colleges of Nursing, began to look at all nurses, especially entry-level nurses, and they worked with practice partners from across the country. And of course, recognize, which many of you probably recognize being in practice, that everybody comes in at a little bit of a different knowledge level. So sometimes there's a steeper learning curve for a new graduate nurse, or even someone newly with their master's degree or their doctoral degree. So rather than look at everybody just doing kind of their own thing, they got together and developed this competency-based learning, which is called the New Essentials. And as Dr. Ridge noted, our accreditation body, CCNE, is going to be looking at those and making a decision by next year if they're going to incorporate those into our accreditation visits instead of the standards that we use now. So there's 10 domains for nursing, and there's 8 concepts, and they are divided into mostly pre-licensure, or those pre-BSN, and then those in the graduate level. And so they need to be incorporated throughout the entire curriculum. And the idea is that if we measure competency instead of measure knowledge, that we will be assured that all of our graduates will begin practice with the same amount of competency, and that should ease the transition into practice. So the 10 domains are knowledge for nursing practice, person-centered care, population health, scholarship for the nursing discipline, quality and safety, interprofessional partnerships, system-based practice, informatics and healthcare technologies, professionalism, and personal, professional, and leadership or leader development. And then the 8 concepts are clinical judgment, communication, compassionate care, diversity, equity, and inclusion, social determinants of health, evidence-based practice, ethics, and health policy. So all of these, and for each of the domains and the competencies, there are sub-competencies, which don't all have to be measured individually, but will be incorporated into the courses. So we're basically looking at the outcome that students who finish a course or the program will be able to demonstrate all of these competencies, and that will be throughout all the courses. It may not necessarily be writing a paper. It could be a self-guided self-reflection. There are a lot of different things that we're looking at to observe and evaluate whether or not we think the competency is met. So there's going to be an ongoing self-assessment as well as an ongoing assessment by faculty in the courses, and then the opportunity to do more when you get into the 8,000 courses, into the practicum courses, to really show that you are meeting all of the different, you have to meet all of the competencies by the end of the program in 2 years. So some will be mixed into all courses, some will be that there's a very specific quality and safety course, and then there's a competency for quality and safety. So the majority of that will be met in one course with a few other things interwoven. Okay, next one. So the next 2 slides are our foundation courses, and you can see that there's the 7,000 is our clinical immersion. And what we're looking at in this is that you need to have, currently by our standards, our accreditation standards, each graduate from a DNP program has to have 1,000 hours of practice. 500 hours are built into our practicum courses at the end. So before you get to the practicum courses, you need to meet another 500 hours. We know everyone will come in with some level of credit of practicum hours from their master's program. So then when we get a little bit further and talk about these foundation courses, the 7,000, which Dr. Rich mentioned, is a clinical immersion, and it's set up specifically for you to be able to get up to the additional 500 hours before you go into the 8,000 courses, into the practicum courses, to add that 500 hours on. It's variable credit, and there's 1 credit for each 125 clock hours that you do, and then eventually those will be and they're repeatable, so you can take them along with, concurrent with some of the other entry courses, or you can take them all up front in the beginning before you start the other courses. And that's a decision that each student will have to make, depending on what their family life and workload is. How much can you imagine? Can you, if you're thinking in 8 weeks that you have to meet 125 hours, how many hours a week is that for you in addition to other classwork? So that's something that you'll be advised upon with the faculty advisors to see what works best for you. But they're repeatable up from 1 to 4 credits. And then you will get the credits waived once you meet that 500 hours. So then your program will be shortened by basically the 4 hours. It looks longer because we have to include these 4 credits for your immersion, but then it actually really is shorter than that. So these are considered the foundation courses. They can be taken in any order. There isn't really a prerequisite of one before the other, but all of the foundation courses have to be completed before you can move on to the practicum courses. So you can see they're very specific. We have the information management into health technologies, scholarly evidences, like research and evidence-based practice, culture and safety. Jenny, you can go to the next slide. Financial management and the economics of healthcare, person-centered care, population health, and then nursing leadership and professionalism. So these are all the foundation courses that must be completed before you move on to the practicum courses. Okay, next slide, I think is for you, Dr. Ridge.
Yep. So I'm going to ask Jenny, we have a couple of polling questions, and I'm going to ask Jenny to launch those. And so the first one says, do you reside within driving distance to campus? And the reason we're asking that question is there may be some of the opportunities with the OD PhD students may be on campus only, and we're just trying to get a sense of how many students that are interested in the program live within driving distance to campus. The second question is asking, do you have 500 or more clinical clock hours as part of your MSN degree? So if you're an alum of the program, you have either 120 or 140 hours. That means you'd have 1 waiver credit for NRHL 7000, and you'd need to take 3 more credit hours. But if you are not an alum of our program and you graduated with a master's level nurse practitioner program, you had over 500 hours. And so you will come into this DNP program with all those hours. You would be waived all of your 7,000 credits. You wouldn't take any of NRHL 7000. So we're just trying to get a sense of how many participants today have 500 or more hours. And if you do not have more than 500 hours, are you interested in doing that NRHL 7000 before you start foundational coursework, or after, or concurrent with foundational coursework? So if you could just take a minute to answer the polling questions.
We've got 4 of 8 in. They're coming in.
Awesome. And I think Jenny's going to be able to show the results. And I'm going to actually jot some notes down because I don't know in the recording if we'll see the polling or not.
I can share it on the main screen here.
Okay.
You're able to see it, right?
I don't see anything
You
yet.
don't see it?
I
Okay.
just
No.
see the survey.
We just see the survey questions.
What do you want to just tell us what the percentages are?
Yeah. So for do you reside within driving distance to campus? We have 3 that are yes and 2 that are no.
Okay.
For the 500 or more clinical hours, answer across all 5 is no.
Okay.
And so the last one is if you don't have the 500, 4 prefer to complete it before foundation work, and 1 says concurrent.
Okay. Before is 4 and concurrent is 1 person. Okay, that's really helpful. So the way, so I think, at least in my view, you can click on the X to get rid of the survey questions. That's how I saw them. They just kind of popped up on my screen.
Yeah, I'll click end poll.
Yeah, so the way the curriculum, so when we launch the first course next fall, which is in very, very end of August, NRHL 7000 and NRHL 7700 will both be offered in the first term. And NRHL 7000 will basically be offered every term we have students that want to take it. So they're really, you can create your own advising. I mean, you can work with your advisor to create your schedule and your plan of study, but you could take all 3 of your 7000 courses if you wanted to do them 1 credit at a time. You could do those first and then move into foundation courses. You could take a foundation course, you could do a practicum, 7000 credit. So there's a lot of different ways, or you could do it concurrently. So the plan for us is just to work with each student individually to create a plan of study that makes the most sense for you in your life and what you need to do prior to getting to the 4 practicum courses. So a prerequisite for NRHL 8800 is that you have completed the 4 credit hours of NRHL 7000. And again, just so that it's clear, for every 125 clock hours you already have as part of your master's degree, you have 1 credit waived. So if you have over 500 hours, you have all 4 credits waived and you don't take NRHL 7000 at all. If you're an alum of the program, you'll basically take 3 credit hours of 7000. So you'll complete the foundation courses and your all the NRHL 7000 hours before coming to practicum. You'll see that practicum is divided into 4 different courses: project proposal, development and practicum, implementation and practicum, evaluation and practicum, that's evaluation of your project, and then dissemination and practicum. And each of these courses includes 125 clock hours of practicum in an 8-week course. So by the time you finish the 4 courses, which gives you 500 hours, plus all your 7000 hours, you have the 1000 hours that are required for accreditation of the program. Stay on this slide just for 1 second, Jenny. We talked about touch points of coming to campus. So one of them would be in 8800 in weeks, most likely week 7 of the course, with week 8 as sort of a backup, but depending on how big a group we start, it might be in weeks 6, 7, and 8 that we'd schedule out who's going to be presenting on which days in those weeks. And you'd know when your synchronous touch point is. And then the other synchronous touch point would be in 8806, where you'll actually defend your project. Okay.
Can I interject for 1 second?
Sure.
Before we get to the project, just for your own thinking, while you're trying to figure this out, that 125 hours works out to about 15, little over 15 hours a week. So depending on what your work schedule is like, that's what would be required. So if you were taking a course and doing a 7,000 concurrent, you'd have 15 hours a week that you'd have to be in a clinical setting, doing those hours in addition to your coursework. So it's nice to let you know that ahead of time in case you want to plan, a couple of days vacation or a couple of days off in a row, and you can crank out, 30 hours in a couple of days. So it's flexible for you. You just have to have them all finished by the end of that 8-week course. But that's what it averages out to be, about 15 hours a week in order to get the 125 in the 8 weeks.
Yeah, and another point to make about that is there is opportunities for, I'm going to use the term indirect hours, but essentially, let's say, you're scheduled to do your clinical work, and part of what you're going to be doing is revising a policy. If part of that then will be presented as part of your clinical project, the clinical work you're doing in NRHL 7000, that work could be done, on site or not on site, but it is related to those clinical hours. And so we call them indirect, and you're allowed to have a portion of indirect hours. So it's not, all 125 hours have to be in a clinical setting like it was with your master's degree for many people. Okay, so the project, we're on the project slide. So all students will do a systems-based DMP project, and this is just a little snapshot. The purpose of the project is to advance your knowledge on expertise in person-centered care, population health, systems analysis, and leadership. You're going to be translating evidence from the literature in a scholarly approach to constructing, implementing, evaluating your project to improve healthcare outcomes. It will involve leading interprofessional. We say inter and intra professional here, so that's inter is between various disciplines within the discipline of nursing to facilitate systems level change. And you're going to be contributing to nursing knowledge through your scholarly work and addressing the needs of local, regional, national, global healthcare providers. So the project is a much larger scope. If you did a capstone project as part of your master's degree, that's typically focused on in a particular unit. This would be more throughout an entire organization. It's a much larger systems-based project. Okay. Not going to read everything on here, but this is just a snapshot of types of jobs that you might be interested in that would require a DMP. Not all of them will require, not all institutions require a chief nursing officer to hold a DMP, but many institutions do require that. So this is just a snapshot. It would really kind of depend on the organization and this, where you're at. If you're in a more urban or more rural area, that might vary what the level of highest level of education might be, but these are very typical positions for DMP grads, including working in academia. I have a DMP. Okay. All right. This slide is really, really busy. It's all on the website. I'm going to turn it over to Jenny. She's going to walk through the admission criteria.
Thank you. Yes, there are kind of like a game show. These are going to be the 10 things that are going to happen before you get into the program. So basically what we're doing is going over all the 9 tiles, and to get to the last point would be after everything's turned in, you have that interview with Allison or a designated faculty. So after this presentation is done and I send you everything with the recording, I'll also send you the steps on how to apply, because if this is what you'd like to do, if you'd like to move forward, we'd love to have you. So the first step is filling out an application. So there's an online application that you'll fill out. So some of the basic requirements are, obviously you have to have an MSN or a higher degree from a regionally accredited college or university. And what we'll do when you apply is you'll have to list your academic history of the schools that you've gone to, and we just need the official transcripts from those universities on file to make sure we have everything there. So that covered 2 of those squares. We'd also like to see a cumulative GPA of 3.0 or higher on your master's or higher level work. When you fill everything out, you'll also have the chance to see the clinical practice verification form. If you're a Benedictine MSN alum, Dr. Ridge will fill this out for you. Is that right? Yes, we went over that. So it'll be a form that needs to verify the hours that you've done. You'll need proof of your unencumbered license as a registered nurse in the US. I can look that up, so there's nothing you really need to do on that end. We do like to see a minimum of 2 years of full work experience as a registered nurse in a healthcare setting. Also on the online application, you'll see an area where you can list people for letters of recommendation. So what you'll do is you'll write, you'll type in their name, their email, and what they'll do is you'll have the opportunity to have those people submit a letter on your behalf. Ideally, it would be someone who already holds a doctoral degree, that's preferred. But if not, you can connect with someone who has an MSN, and it really needs to be someone who knows you, who can address your academic, communication, and professional skills in your quest to join a doctoral level program. So once we get those 2 letters, then you'd also have to upload your resume, because we'd like to see the work history. And then what might take a little time and reflection is to come up with your purpose statement. So this is a 500-word essay. It's a personal essay. It's going to demonstrate your writing skills, and it's also going to give the department a little background about who you are as a candidate to this program. So that also has to be turned in. Once all of that is turned in, we will submit your file for review and then contact you to schedule a time to go over or to have your interview with the department, just to have a conversation and discuss maybe some questions you have. Dr. Ridge, did you want to kind of, I know when I talk to the candidates of the OD program, they always wonder, what is it that we're covering in our interview? Could you maybe speak to that? Because I know it could be a little nerve-wracking.
Yeah, so basically, after you submit all your materials, we have an opportunity in the Department of Nursing and Health to review your application. So I will be reading your purpose statement, and it helps us for selecting your advisor. I happen to have a background in psych mental health nursing. Dr. Jesuit has a critical care background, but she has done an extensive amount of work in end-of-life care and ethics. So if you're really particularly interested in end-of-life care or gero, she may be a better choice of an advisor than I would be for you. So as we read your purpose statement, look at all your materials, in that interview, it's an opportunity for me to ask questions just to clarify, who you are, what are your goals for the DNP program? Do you have an idea about a project? We can talk about whether that project is too big a scope or too small a scope, or just right. It's like the Goldilocks and the Three Little Bears. Is it, perfect, or is it too tiny or too big? So we'll talk about that. We'll talk about some of the realities and the rigor of going through a DNP program, and are you really prepared for that? Most of our graduate students are busy working professionals. They have families, they have pets, they have elderly parents, they have hobbies, they want to have a life. So is this really a good time for you to go through school? If you're an alum of the program, we'll talk about the NRHL 7000, or if you're not an alum, I'll look at your verification form, and we could talk about what your options are for your plan of study. We can even kind of roughly put together a plan of study. It's not written in stone. So it's just really an opportunity to connect, you to ask me questions, me to ask you questions, make sure this is really a good fit for you and the timing is right. And if it is, then, what is it that, how do we want to go about working through the coursework and practicum to complete the degree? So,
great. Thank you for covering that.
Yeah.
I feel like the interview process is really important, like you said, in finding if this is the right fit. I know I do the recruitment for the OD program, which Dr. Ridge mentioned. You might have chances in the future, like lecture series, to come and collaborate with our other PhD students. That program takes place on campus. about every 3 weeks or so. Students from all over the country who are in the cohort come here. The advantage of this program is that not only is it 2 years instead of 3, but you have the opportunity to do it online, which I think makes things a lot easier travel-wise when you have families and you have things going on. So that is definitely a bonus. Messed up my slides here a little bit. Okay, so let's talk about financing your Bennu education. So there's quite a few different options when it comes to financing a doctoral education. One thing that we have is an interest-free tuition payment plan, and that is set up through student accounts. So for a very small fee, you have monthly payments that could be extended for the duration of your program. So there's not interest, there's just an upfront. It's like, I think it's less than $100 to set that up, to have a payment plan if you choose not to take loans or pay out of pocket. We also offer employer tuition assistance. So, or rather, the ability to have your employer tuition assistance be directly billed. So either there's 2 routes you could do it. You could have your employer get billed directly from our student accounts department, or you could choose to have your payment deferred until your employer reimburses you for it. There's different ways to do that. So those links on there take you to the student accounts page so you can read the breakdown of that. It also shows down the breakdown of the billing, the cost, everything associated with the program. That way you can budget well. And then there's obviously the option to apply on the FAFSA for graduate student loans. Some people choose to do part of their payment through loans, another part through employer reimbursement, and then paying out of pocket. There's different ways that you could make it work for you. And if you're a veteran, we are a yellow ribbon school, so we participate in that. So if you had qualified for any post 9/11 funding at 100%, the yellow ribbon kicks in when you've run out of that. So that's something you could look into as well. And if you happen to be a Bennu employee, there is an employee discount for a doctoral program for just yourself. So those are all the options we have there.
Jenny,
So
I'm sorry, Jenny, can I hop in and just say one thing? All the questions about financing your education will not be covered in your DMP interview with me. That's not my area of expertise. Once you're admitted to the program, or if you want to meet with somebody from accounts, you can do that to talk about all those questions. But that is not my area of expertise, and it would be very challenging for me to help you other than giving you the contact information, just so students know. The financing piece, that's all through the billing office.
yes, and so when you, after this is done and I send the information, I'll include the cost breakdown, the example of the program planner that we have, so that you can see how this might work for you, because not only is time a consideration, but finances as well, completely. Um, so on these slides here, these are links that link to our academic support center, our alumni website, and then our Office of Career and Personal Development. I think they're all very important. If you're an alum, you already know you have the ability to join our alumni network. What's great is they have a lot of things you can do and stay active. So if you're new to us, that's something to look forward to at some point, because they do a lot of events and things to participate. What's nice too is the Academic Support Center offers helping hand with writing. If you have any type of issues that you'd like to talk to them about, it's not just for undergrad, doctoral and grad students can go there as well. So you could check that out. And then the Office of Career and Personal Development is great because they host a lot of things on campus, online, for undergrad, grad, and doctoral students. They often have different series going on of like how to update your LinkedIn resume, mock interview skills. They have a lot of recruitment events on campus too. So it always is worth, I think, checking them out. So those links are there for you. So we've reached the time of questions. If anybody has any questions, feel free to enter them into the chat. We can take them as they come in. And we'll just give it a minute in case.
I know it's a lot of information to absorb in a short period of time. And for us, we know it so inside and out that, it makes so Jenny's available for questions. There's a lot of information on the website. She's going to be providing information, more information to you in writing. You'll have a link to this webinar you can listen to again. So we're definitely here to support you as you go through the application and admission process. And again, we would love to have you, if you're an alum, come back again. And if you're new to Benedictine University, I think that one strength of our program that we really didn't touch on is that the faculty are very committed to the students and provide a lot of support and understand what it means to be a master's or a doctoral level student, in addition to being a working professional nurse. And so I think that's the strength of our program and the ability for the networking with the OD PhD students. Those are two really unique characteristics of our program.
Absolutely. So as I mentioned, I will email you and send you all of the information about the program. My contact information is on here as well. If you are local or if you're in town and you want to maybe schedule a time to view the campus, look around, even though this program is online, you're still welcome as a student once you're admitted to use all the facilities, whether it's to go work out at the Rice Center, go to the library. We have a wonderful art gallery at the top of it that's very interesting. So I'd love to give anyone a tour if they wanted to do that. But yeah, if other questions come up, feel free to just email them to me in response to what I'll send out tomorrow. So thank you everybody for attending, and we'll see you soon, hopefully.
Thanks so much,
Thanks.
everybody.
Thanks, everyone.